The renal diagram simplifies documentation and supports easy follow-up for patients with suspected hydronephrosis. No need to manually type findings. You can simply assign a label from a pre-populated list that corresponds with the grade of hydronephrosis, providing a quick assessment and review of the urinary system. To begin, select the correct probe and preset from the patient page. In this case, I selected the C1 to 5 probe and renal preset. Scan the anatomy of interest, for example, the right kidney. As you are scanning, the anatomy is labeled for you. Obtain the desired image and tap Freeze. You can store a short cine clip by simply tapping Store. Select the appropriate finding, normal, mild, moderate, severe, indeterminate for the right kidney. In this case, I will select normal. The finding will be placed into the selected location in the renal diagram. Tap Store. Tap the left kidney icon to continue the exam. Then document your findings. It'll store right along with your image. Tap the bladder icon and finish your exam. Upon completion of the exam, you can review the renal diagram by selecting Review on the top left-hand side of the touchscreen. The renal diagram will appear when you enter the review screen. If multiple images were taken at any location, simply swipe the image in that location to view each one. You can add comments regarding this exam by using the summary box in the upper left-hand corner of the touchscreen. Need to change a finding? No problem. At any time, you can tap Findings and change the selection, and the new finding is saved. Tap Store to save a picture or snapshot of the renal diagram. If the renal diagram did not appear when you enter the review screen, you can tap the icon at the bottom of the review page.